Slovenská diabetologická spoločnosť bola založená v roku 1968.
Slovakia Diabetes Society was established in 1968 with the main aim to bring together opinions and experiences of doctors and patients, to foster communication, and to exchange these experiences in order to find paths leading to the best possible caretaking and result of our patients. We conduct not only professionally oriented activities, such as congresses, but we also focus on social activities. In the last years, we have attempted to affect the public opinion and to improve their awareness of this disease, of its consequences, and of the possibilities how to fight against it. Therefore, we may conclude that our activities entail also broad social education on diabetes and its consequences. Moreover, we have organized a number of social activities within this context, as the program Blue Circle, where we work with the youth, or the program Diateens, where children are informed about forms of healthy lifestyle and they create projects of their own. Among the past programs which we have organized, I would mention the Run Against Diabetes, which took place in the fortnight of the annual National Congress on Diabetes, with the main intention to show wide public the importance of physical activities when preventing diabetes. We have decided to create a tradition out of these annual runs. In Slovakia, in the past 20 years, the number of patients suffering from diabetes has increased in a double and currently reaches the number of almost 400,000 patients, counting for 7% of our entire population. The highest amount of people suffering from diabetes is in the age from 50 to 70 and creates the half of all patients. The prognosis for 2030 predicts an increased number of patients suffering from diabetes up to 10% of the population.
Pokiaľ sa týka výskytu samotných chronických komplikácií, neuropatia sa uvádza.
If we take into consideration the existence of chronic complications to the disease, neuropathy is to be found within the amount of 20% of diabetes patients in Slovakia, nephropathy in almost 13%, retinopathy in 20% of patients. 0.3% of patients are blind. Cardiovascular diseases and brain or vascular episodes have occurred in 7% of the patients, and an amputation was necessary for 1.3% of the patients.
Slovenská diabetologická spoločnosť
Slovakia Diabetes Society understands diabetes as an intersocial problem, and therefore we attempt to communicate with the government, its departments and offices, to strengthen the awareness of this disease and to improve not only the prevention of spreading of diabetes, but also to improve the care for the existing patients. We have suggested a national diabetes program considering the need for prevention. We would like to focus this program on the fields of education, agriculture, and also urban planning. One of our greatest ambitions considering the field of education is to create a subject of well-being and healthy lifestyle, which would become a compulsory part of the curriculum. Within agriculture, we try to support the idea of marking food products with two distinct categories, healthy and unhealthy food, in order for the ordinary customer to know which products are suitable or not suitable for a healthy diet.
Diabetológia na Slovensku má niekoľko štrukturálnych jednotiek.
In Slovakia, diabetology has a number of divisions. The currently 170 diabetological outpatients departments, diabetological centers located in every region, and the headquarters located in the National Diabetological Institute in Ľubochňa create the main parts of the structure. The headquarters takes care of patients from the whole Slovakia and is especially focused on those patients who require a special form of care.
A stará sa predovšetkým o tých pacientov, o ktorých sa na ambulanciách či bežných interných pracoviskách interného lekárstva nie je možné adekvátne postarať. Slovenská diabetologická spoločnosť samozrejme...
Slovakia Diabetes Society also supports scientific research, for example in the field of genetics or clinical medicine. We support the activities of young scientists, young diabetologists, and young doctors. We also attempt to interact on the level of the European countries.
A samozrejme snažíme sa zaujať určitú pozíciu aj v rámci európskych krajín.
One of the many more functions of the Slovakia Diabetes Society is to communicate with the patients suffering from diabetes and their organizations, most of all with the Association of Diabetic Patients of Slovakia. The importance of this communication lies on the feedback and on the amount of allocated information from the patients considering their needs and requirements, what they need, how they need it, and our role within.